What is cancer? A disease which occurs when changes in a group of normal cells within the body lead to uncontrolled abnormal growth, forming a lump called tumor. True of all cancers except leukemia. If left untreated, tumors can grow and spread into the surrounding normal tissue or other parts of the body, the bloodstream, the lymphatic system, and can affect the digestive, nervous, and circulatory systems, or release hormones that may affect body function. Cancer cells are cells gone wrong. In other words, they no longer respond to many of the signals that control cellular growth and death. Cancer cells originate within tissues and they grow and divide. They diverge even farther from normalcy. Over time, these cells become increasingly resistant to the controls that maintain normal tissue, and as a result, they divide more rapidly than their progenitors and become less dependent on signals from other cells. Cancer cells even evade programmed cell death, despite the fact that their multiple abnormalities would normally make them prime targets for apoptosis. In later stages of cancer, cells break through normal tissue boundaries and spread to new sites in the body.
Symptoms. Signs and symptoms caused by cancer will vary depending upon what part of the body is affected. Some general signs and symptoms associated with but not specific to cancer include fatigue, lump or area of thickening that can be felt under the skin, weight changes including uninhibited loss or gain, skin changes such as yellowing, darkening or redness of the skin, sores that doesn't heal or changes to the existing moles, changes in bowel or bladder habits, persistent cough or trouble breathing, difficulty swallowing, persistent indigestion or discomfort after eating, persistent unexplained muscle or joint pain, persistent unexplained fever or night sweats, unexplained bleeding or bruising. Diagnosis. Diagnosing cancer at its earliest stage often provides the best chance for a cure. Your doctor may use one or more approaches to diagnose cancer. It includes physical examination, laboratory tests, imaging tests, biopsy. During a physical examination, your doctor may look for abnormalities such as changes in skin color or enlargement of an organ, lumps that may indicate the presence of cancer. Laboratory tests. Laboratory tests such as urine and blood tests may help your doctor identify abnormalities that can be caused by cancer. Imaging tests. Imaging tests allows your doctors to examine your bones and internal organs in a non-invasive way. Imaging tests used in diagnosing cancer may include a computerized tomography scan, bone scan, magnetic resonance imaging, ultrasound, and X-ray. Biopsy. During a biopsy, your doctor collects a sample of cells for testing in laboratory. In most situations, a biopsy is the only way to definitely diagnose cancer. Treatment of cancer. Treatment include surgery, chemotherapy, radiation therapy, bone marrow transplant, immunotherapy, hormone therapy, and targeted drug therapy. Surgery. The goal of surgery is to remove the cancer or as much as cancer as possible. Chemotherapy. Chemotherapy uses drugs to kill cancer cells. Radiation therapy. Radiation therapy uses high-powered energy beams such as X-rays and protons to kill cancer cells. Bone marrow transplant. Bone marrow transplant is also known as stem cell transplant. A bone marrow transplant can use your own cells or cells from a donor. Immunotherapy. Immunotherapy, also known as biological therapy, uses your body's immune system to fight cancer. Hormone therapy. Some types of cancers are fueled by your own hormones. Examples include breast cancer and prostate cancer. Targeted drug therapy. Targeted drug therapy focuses on specific abnormalities within the cancer cells that allow them to survive. Preventing cancer. There are ways to reduce your cancer risk. It includes exercise, avoiding tobacco, eating a healthy diet, being skin safe, getting vaccinated, maintaining a healthy weight, limiting alcohol, getting screened, and knowing your family history.